Hi, I'm glad to be here with you today. I'm Stacey Alexander. I'm the Vice President of Thought Leadership at AARP. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and over to choose how they live as they age. This topic is very top of mind to us. Our team is focused on really understanding longevity and what it means and all the intersections it means for our society.
And I'm Vipin Nakor. I'm the CEO and co-founder of Home Care Hub. Quick background, traversed the world of software development as a developer at IBM, and then went to medical school afterwards, and currently I'm a practicing internal medicine physician over at the Cleveland Clinic, where I've been the last 14 years, and one of the University of Toronto hospitals, and as mentioned, I'm the medical director for TD and teach at the medical school in Toronto a bit, and with Home Care Hub, we're focused on aging, in that we're trying to create new structures for people to age gracefully, basically almost like an Airbnb for senior housing, to create these small homes on demand as alternatives to nursing homes.
Great, and thank you very much. So before we dive into what we're going to do about solving the future, first let's ask a very simple question. Why are we living longer? What's the evidence that we're living longer from modern medical intervention versus advances in better lifestyle and better self-care? We know that the eradication of infectious diseases, beginning with the germ theory in the late 19th century, combined with understanding clean food and advancing food supplies across the world, over a 100-year span, increased lifespan from the 30s to the 70s over some 100-year period. But what's the evidence that what we're doing today in healthcare, to be very concrete, what's the evidence that what we're doing today in healthcare is having a similar influence on lifespan? First, let's talk about lifespan, and then we can talk about health span, and we'll try to keep those separate. Stacy?
Sure. Now, I'll talk a little bit about some of the non-medical stuff, and you can talk about the doctor can talk about that. But you're right. A lot of the advances that we made in life expectancy really came from advances we made in the last century, and a lot of that has to do with public health. A lot of the innovations we made, and a lot of we've done with lifestyle choices. And so folks are living longer. We know, as you said, life expectancy was around 47 in 1900, and now around in 2016 that was around 81 years for women and 76 years for men. So we know that it's going up, but we also know that those disparities exist that are really impacting longer lifespan for all of us. So I think if we can really focus on addressing the disparities that keep many people from living longer, healthier lives, and those are disparities based on race, on socio-demographic factors, geography. If we can really tackle that, I think we can deal with life expectancy. And when we get to health span even more. But we are living longer, but there are a lot of us who are not.
And it's a straightforward question, but it's just such an interesting question as well. When you actually look at our longevity, sort of how you had alluded to things earlier, we for thousands of years, right? Like, we didn't increase our lifespan all that much, right? Like, we were in the 20s, I think, like, around the 1100s, et cetera. And then, again, really, most of this has happened over the last 100 years, where if you look at a graph, it just goes almost up because of all the things you mentioned, germ theory, antibiotics, preventing accidents even, and vaccinations, et cetera. Side note, my father's older brother died in India from typhoid, and my father got it a few years later, and antibiotics had just been kind of created, chlorobenzol, and it's, here I am, right? So, like, it's just fascinating thinking about those, stepwise changes that happen. But beyond that, I do think there's been some progress on in some areas in terms of what our health system has done, and in medical advancements. When you just look at cardiac disease, right, we have seen the probably about a 55% increase in longevity for people who have cardiac disease now compared to the past. Obviously things like a cabbage, but we talked about this before, just doing more cabbages on someone to get extra 3-4 years may not be that beneficial. But when you look at just obviously all the therapeutics that are just blood pressure control, et cetera, and statins, and even be able to do, TAVRs, to be able to just, there were patients that, for many of us who've treated some older adults who've had valvular disease, I mean, it was almost like there's nothing for you. And now you can go in with a little intervention and pop open the valve. It's remarkable. You can get several extra years. So I do think there is some on the medical side as well. Can we do better? Absolutely. And then I think the next wave is all these innovations that are in the pipeline. There's probably about 10 to 15 or so really interesting research innovations, therapeutic plasma exchange, et cetera, that are supposed to take us to around the age of 130, as we expect one or two of these breakthroughs to occur over the next several years.
So do you think that the medical advances, the technical advances, plasmapheresis, plasma exchange, will have a major contribution to longevity on the planet Earth, or will it be continuing to focus on reducing the burden of smoking and continue to focus on trying to have lifestyle changes to reduce the burden, the health burden of obesity? How do we as those as healthcare leaders, policymakers, payers and providers, all assembled in this room, how do we prioritize the medical innovation needs and demands to do these things versus the policy, lifestyle, changing environment demands to do these things? Who's in charge of this? How do we figure out how to balance these priorities?
Well, I think it's going to take all of that you mentioned, and I think we have the capacity to do all of that. I think also it's going to take more cross-sector collaboration, right? So everybody has a part. So the healthcare system can do what it can do. Organizations like AARP, who's providing information tools to consumers, can do that. We have members of our Age Tech Collaborative here who are creating products, tools, and services who are really helping make things possible. So I think we're at a point that we have to do it all, and so that we have to make sure that every sector is stepping up to do its part. And I think also, we talked about how people are living longer. I think we've done a really good job of getting people to midlife, and I think the question of really how do we extend longevity once folks make it to 50 and beyond is a key question in that as well. And I think there's market opportunity to do this, and I think that is another incentive.
I think when we think about resource prioritization, it's something I think quite a bit about when I teach sort of innovation to organizations. And for some of you who know, the innovator's dilemma and Claire Christensen's work and talking about how larger organizations tend to spend so much time on their current operations and not enough on the innovation. And I see sort of healthcare very similarly in that we spend so much time on, just extending people's lives a little bit longer when really we need to be doing much more on the prevention side. So really some of just the basics, right, of making sure people are exercising, eating properly, stress management, mental health, et cetera, getting all that right. And then there's a third bucket, which are those innovations and technological advances. So if you look at those three buckets, you've got traditional healthcare, prevention, and then technological advancements. We're just way too high on the first one. And both those other two buckets, we need to spend a lot more time. When you think about some of the technological advancements, for some of you know, Bumex, it's like a water pill, essentially, right? So this is an older drug that some of the computers we have at IBM, the quantum computing we have at IBM, I worked there like 25 years ago, but I don't know why I say we. I meant to say we at Cleveland Clinic, where the IBM quantum computing is over in Cleveland. We looked at different medications. Actually, it was UCSF who would use this computing power to say, what medications could be beneficial in terms of blocking, the tau proteins to neurons, et cetera, when we think about Alzheimer's. And it found this old drug, Bumex, which we don't even use that much. I've prescribed it a few times, but that's remarkable. We might be able to have interventions that can, potentially, I don't want to say cure Alzheimer's, but advance therapeutics towards Alzheimer's, which is remarkable through computing power. We have to invest in some of these technologies that are going to be able to do that. And everyone's talking about AI, so it's no secret, but you really need, there's usually a lag. So people will talk about it, but the organizations might not actually do anything about it. So they actually have to really put their money where their mouth is, in my opinion.
So if we think in terms of major investments and priorities in delivery of healthcare and in focusing on improving lifestyle, are we trying to help people live longer, or are we trying to help them live better? And if the overwhelming evidence is that we've achieved a major healthcare changes, vaccines, antibiotics, better understanding of the pathogenesis and risk factors of heart disease that have gotten us to be living to be 75, 80 years old today. Are people living better in their older years than they did, as Mike referred to in the opening remarks? What used to be 55 years old, you would be looking at the end of life. Now we're looking at pushing that back, but what is the quality of life like? And should we be deploying more resources and more science and more discovery and more focus of AI on improving the quality of life of the people who are already elderly, or should we be trying to get more people to live to that point? These issues I don't hear talked about much, but to me they seem very real and very obvious.
So we look at more healthy years across the lifespan. So we want folks at every age to live more healthily. And so that is the focus that we're looking at AARP, is that how do we help people have more healthy years? And so we don't look at kind of just that choice of just those two things. It's what can we do to improve the quality of life, to reduce the disparity so that people don't die from chronic diseases that they shouldn't be dying from, and that they can, again, be healthy and also have access to all the tools to live a better life.
I think for me, my answer is similar to my last one, in that you really do need, a balance between both. And I'm sort of skirting around how much you do towards each, but they're just so important. When you think about the number of years in sick years that we have, we've extended our life, longevity. The life expectancy about 6 years over the past 20 years or so, right? Over 2000 to 2019, it was like 5.8 years. The number of sick years is about around 1, depending what country. Our USA is actually a little bit worse at 1.5. So you're spending, the proportion's about the same, but we have to increase the number of healthy years. And then when you ask most people how many people would want to live to the age 100, most people, if you tell them about if they're going to be in how many sick years versus not, is actually going to determine that answer. So we really do need to focus on keeping people healthy. At the same time, there are people suffering who are sick, and it doesn't mean we should be neglecting them. We can improve their quality of life and their emotional well-being and decrease pain and all those things, provide more social connections, et cetera. So it really is important that we don't just totally swing the other way as well. So,
what do you both think would be the major technical or medical or policy advances that would tip the balance to the elderly population today living better, happier, and healthier? What is it we should be working more on now to provide that to the people that are already in that group, and to help the 11,000 people who are turning 65 every day? What should we all be doing right now? How do we galvanize this group to leave here fired up to go deal with this?
So I'll build on something you said. The social determinants of health is still very important, right? So people need to be connected. People need to not be isolated. People need to have housing that supports the way they want to live. They need to be able to be mobility in communities to support them moving around. People need income. People need education. People need all these things that allow them to have a quality of life that really, every statistic that you will look at, when folks have those access to those basic tools, they live longer and they live healthier. And so those are things that we can make a decision as a society to do. We need to address the disparities. We can do that. We need to make sure that folks, again, are educated across the lifespan about what it means to live and age with dignity. And we need to let people understand that aging is a natural process. It is not a deficit. And so we need to have that mindset across the lifespan.
So I have probably three main areas that I think about in terms of policy. But before I get to that, one other policy I guess area where we should focus on is end-of-life discussions. To me, that's very low-hanging fruit. The number of times I've had to be in a literally code or do CPR on someone when I know that wasn't really probably what they wanted, right? And it's partially just because the structures that we've set up, right, in our health systems, et cetera, in society. So that's just low-hanging fruit. When I think about sort of the bigger three policy implications, one is just around that prevention aspect, right? We talk a lot about it, but we don't actually do a ton about it. I mean, the good thing is that there's some of the structures in place with value-based care, et cetera, and some newer models that are coming out where we're not just, we're recognizing at least now that the 15-minute visit with your family doctor is not going to drive behavior change in the society. So you're starting to see newer models around that. But I think that's where a lot of the focus has to go on. Like, how can you really get people to change behaviors? Because a lot of those things that we've talked about are things we know. It's all the same basics that sort of mentioned around, exercise. If you exercise, it's the best medication. Just put it in a bottle if you could. That would be incredible, right? So I think that structure there. The second is supporting all those technological advancements in terms of research, data. Health systems have to move faster. I think they could take a little bit of a lesson from the Silicon Valley world in terms of going fast. Of course, this is healthcare, and you want to be thoughtful that people can get hurt if you aren't thoughtful of these things. But there's also, when there's interventions out there that exist that are not being used, to me that's a tragedy, right? And that's what happens because health systems aren't going fast enough in learning, et cetera, as well. And then the third is just, how do you set up the structures to support an older population, right? Like right now, when you look at the number of workers per, I think it's retired people, it used to be like 6.9 to 1 back, I think in the 50s, 60s, and now it's like 4, and it's going to go down to 2.7, right? Like, this is not sustainable. That's just one example. How do you set up the health system structures for an older population? All these things that have to be thought about from that standpoint. So those are sort of the three big areas I think we need to focus on.
I just want to chime in. Underpinning all of the great things you talked about is trust, too. Because those folks are going to take those interventions, the folks are going to listen to their providers. They need to trust that they are safe and they're heard and they're listened to. And I think that's really important as we look at this. And then we look at the innovation and we look at all the new interventions that could come on. If folks trust that they have been factored into all of these things that are developed, that their experiences have been listened to, that they are part of these trials and all these things, I think that really helps folks adopt any of these new innovations.
And on the innovation side as well, and even to the point around just behavior change, et cetera, I mean, you sort of alluded to this as well around just the disparities, inequities that are out there. Where I went to med school in Chicago, just a few miles down the road, you've got a life expectancy from 60 to 90, right? So you need to be able to spread the innovations, which I think is really critical, and thinking about policy implications around that as well.
Exactly.
I would make a pitch on the importance of continuing to double down on the importance of inflammation as a root cause of the suffering that occurs on the medical side in the elderly population. So inflammation is a root cause contributor or makes worse the 2/3 of the principal causes of death on the planet Earth every year. Inflammation contributes to cancer, heart disease, stroke, metabolic syndrome, obesity, neurodegeneration, Alzheimer's, diabetes. And to make a plea for focusing on what we have to do to improve trust, to develop the right policies, to advance medical care for this population. We have to also continue to think about the root cause and developing new therapies for inflammation, which actually may go very far towards improving health span as well as lifespan. I think that's an open scientific question. So we're coming down to our remaining few seconds. I'd like to ask each of you to tell me, how long do you think we will all be living in 2050, and how good will we feel?
I plan to feel very good. I'm not sure how long we will be living, but I think we have the power to make sure that we can do better than what we're doing today. I think we can close the disparities gap. I think our children have a great chance of living much long lives, but more importantly, lives with meaning, purpose, and service.
The pundits are saying 120 to 130 based on these breakthroughs that will happen over the next several years. I tend to be an optimist, so I'm going to stick with that, and I'll say 131 to go above. Them.
I also think we're going to be living to be 130, but most importantly, I think we're going to feel like we're 55. And on that note, I'd like to say thank you.